Hello, so my name is Jocelyn Smith and I'm here with Maggie. We are the student leaders for Group 9 and we are going to present our Capstone project.
Hi, my name is Kiana. So I'm going to start with the introduction. So the Quaranteens present social determinants of healthcare. A very important social determinant of health is the quality of healthcare. One big issue that lowers quality of care is the high number of patients that are seen for common preventable diseases. If these diseases are prevented, doctors would be able to focus their time and energy to help patients that have non-preventable diseases. This reduced workload will benefit doctors' mental health and lower the physician burnout rate, which also results in better patient care.
My name is Adelia, and I'll be going over the identified outcomes. So we identified preventable chronic diseases and race and gender disparities as two problems that result in poor healthcare. Chronic diseases are defined as conditions that last 1 year or more and require ongoing medical attention. Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States.
I'm Serena, and I'm going to be reading off a few of the statistics. Number one, chronic disease affects approximately 40% of the US population, which is about 133 million Americans. Chronic diseases are also responsible for 7 out of 10 deaths in the US, and approximately half of all American adults have one or more preventable chronic diseases. The U.S. Center of Disease Control, the CDC, estimates that eliminating 3 risk factors, poor diet, inactivity, and smoking, would prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer.
I'm Jean Angelique, and I'm going to be finishing off the statistics. Diseases of the heart, cancers, chronic lower respiratory disease, cerebrovascular diseases, diabetes, Alzheimer's disease, and kidney disease, together accounted for 65.8% of all deaths among U.S. males and 67.2% of all deaths among U.S. females in 2010. 70% to 90% of chronic diseases are attributed to environmental factors, even though many cases are attributed to genetics. African Americans were less likely than whites to receive breast cancer screening, eye examinations for patients with diabetes, blocker medication after myocardial infarctions, and follow-up after hospitalization for mental illnesses. In a research study done by John Z. Inian titled Quality of Care by Race and Gender for Congestive Heart Failure, it states that African American patients with congestive heart failure receive lower quality of care overall than other patients with similar conditions. Also, the result of the study concluded that women receive worse quality of care than men for congestive heart failure.
Hi, I'm Robin, and I'm going to be talking about some of the solutions. We have 4 solutions to preventing chronic disease that we think are important. For eating healthy, we think healthy food should be required at all schools, and that an agricultural surplus of healthy food should be created so the prices of healthy foods can go down. With getting screened, we think that insurance companies should be required to cover the cost of checkups and preventive screenings, and for individuals who don't have insurance, monthly free screening should be encouraged by a government grant.
Hi, my name is Andres Rosas, and I'm going to talk about other solutions. Getting regular physical activity is empirical to prevent chronic diseases. This can be implemented by requiring physical education all year long through high school and have options of different types of exercises and learning about nutrition. Furthermore, government should give out a grant to public and private workplaces in exchange for the implementation of a physical activity program. Heredity is one of the main causes of chronic diseases transmission. For this reason, it is empirical to know your family's health history so an individual can take take care of his health, knowing possible vulnerabilities and proper precautions can be taken.
Thank you all for listening to our presentation. That's all for now. Let's wave, guys.